Hello, everyone. Thank you for joining us tonight. I have a very special guest with me tonight. But before we get to that, I want everyone to tell us where you're watching from. And if you have any questions as we're chatting, make sure to throw those in the comments and we will be monitoring that and getting to those questions. We do have some that were pre-submitted. But first, I want to start with a little personal update. I know a lot of you have sent me lovely texts and emails asking about our dog, Mr. Barbo, who was hospitalized recently. He is recovering. He's doing pretty okay. Slowly, he's 13 years old, so he doesn't bounce back as well as he used to. I can say that about myself as well. We do have another follow-up appointment with our own vet tomorrow for some things that are still going on. So he's not out of the woods entirely, but he does seem to be rebounding after we canceled our vacation. So it's worth it to have him still here with us, especially at 13 years old. But I just wanted to take a moment to thank everyone for your texts and emails and check-ins. So tonight I'm thrilled to be having an opportunity to chat with my very special guest, Dr. Luce. She has been in practice for almost 20 years. She owns the Neighborhood Vet, which is based out of Brooklyn. Many of my clients use her. And she focuses, I love sending clients to her because she focuses on low stress visits, provides excellent care, has really compassionate pricing, and recently founded Small Bites Rescue, which is a rescue for sort of smaller bite-sized dogs, many of which have pretty extensive medical needs. So while we're going to bring her up to introduce herself, I do want to give a little bit of a warning that we're going to be talking about some difficult topics tonight, including mental health issues, suicide rates among veterinarians, maybe some cyberbullying, all sorts of tricky topics. So I do want to give a little bit of a warning there. But let's bring in Dr. Luce. I'm so excited to have her here tonight.
Hi.
Hello.
How are you?
Do you want to give us a little introduction? Thank you for being here.
So I'm a little less good about being on camera, even though it's just here on the computer. I am a single practice owner here in Brooklyn. I am actually board certified emergency critical care. That's what I pursued after vet school. And I see a lot of cases and would love another vet on practice. So you can see.
Yeah,
but
that's a common theme from veterinarians that
yeah,
I'm talking to lately.
Hard to find vets these days. So
yeah.
But I focus just small animal dogs and cats. I used to do exotics, but not anymore past my residency.
Okay.
And it was just emergency critical care. But
great, awesome. Okay, so launching off of that, you've been pretty open about on social media about struggling with, running a practice and being a solo vet and how hard it is to be a vet. Much like being a trainer, I think there's this idea that you're playing with puppies all day, puppies and kittens, and people don't understand the stress that it takes not only to do our jobs, but to run a business as a solo practitioner, that we don't have these big, backers behind us doing marketing and accounting and all of these things for us, that it falls all on us. Yeah. And you're not alone in struggling with those issues. I know vets, particularly female vets, have a much higher rate of death by suicide and increased rates of depression. Can you talk a little bit? Are you comfortable talking a little bit about what else kind of plays into that besides, the obvious, student loan debt and all those things that go into it? But,
I mean, I feel for me, I'll be honest, I'm probably suicidal 3 to 4 times a year. I hit some pretty incredible lows. And a lot of times it comes after really pouring my heart and soul into a patient, and either having the patient kind of not have the care that they need. And, your hands are kind of tied because it's kind of like, in some ways, being a pediatrician, there's a middleman all the time. Like, For kids, there's parents. Well, with pets,
Yeah.
there's parents. There's always a middleman. So, um, and there is just a high incidence of economic euthanasia, probably more so in New York City than I've experienced in any other city that I've been in, and I've been in some bigger cities. Um, and yes, veterinary medicine comes with a price, but I do feel sometimes that depending on the practice, they are a little. Sometimes the prices are a little bit really very very high, and there are other alternatives, and but it's hard when owners can't afford things. They have to put a pet to sleep,
Mhm.
or they just take them home, and you know that they're going to suffer, and you could provide some of the relief, and they don't want to euthanize. That's very
Yeah.
hard. And you can do everything possible. You can communicate and email and text and phone calls and all those things, and then people will still not listen, not take notes, not do like their part in taking care of their pet. And then,
Yeah.
something goes wrong, and then they're making threats about social media, or they go online, they put like a 1-star Google review just because they didn't get
Yeah.
basically what they felt they needed or wanted, even though
Yeah.
they did get it. That's what's
They
really
did.
hard. Those things can
Yeah.
destroy.
I read something earlier this week that compared to sort of human medical and dental counterparts, that veterinarians are much more likely to be victims of cyberbullying. Exactly
Mhm.
what you're describing, bad reviews or, just bad mouthing people or sending, threatening, why didn't you save my dog? That sort of thing. And that veterinarians are so much more susceptible to that than their counterparts in human medicine.
Yeah, I mean, because in human medicine, they have insurance for one, and also it's kind of you can't not necessarily. I mean, I guess you can decline doing therapy on someone, but it's not really accepted in human medicine. They go to the opposite extreme, where perhaps there should be like a peaceful passage for people, but we keep them going even if they don't have health insurance, they don't have money,
Right.
etc.
Yeah.
But with our thing, I don't know what I was just going to say. You were talking about in human medicine also, like I, I don't think dentists get the whole thing of you like teeth, so why don't you do my teeth cleaning for free? And
Yeah.
I need my tooth extracted, I'm in pain. You love doing this, so why don't you do it for free? Or why don't you give
Right,
me
right.
half off? No one ever like barters with their prof- other professions out there, but veterinary
Right.
medicine very much gets a lot of harsh criticism and a lot of harsh words about caring, and we probably are the most compassionate profession out there, um, because
Yep.
they're voiceless. We have to speak
Right.
for them. So
Yep. And I just think it's so amazing. You guys have such a hard job that your patients can't communicate how they're feeling or what's wrong. They can't tell us, with clearly what's wrong with them. And you go in and make a diagnosis sort of blind, without that communication. Whereas a human goes into a doctor and they say, my stomach hurts on the right side. Oh, okay, this is probably what it is. And,
yeah,
veterinarians, not only dogs, but you have to be able to do this in so many species of animals, not just like, okay, I learned the human body as a doctor and that's it. You have to learn all the anatomies and everything for all of these different species. So I'm always so over the top with understanding like how you guys do that. It's magical to me.
yeah, that's cool. You learn a tremendous amount, and then you kind of tunnel vision and go into your own little subcategories about specialties.
Yeah.
It's
Yeah.
larger, small, and then other categories. There's tons of specialties out there now that didn't exist even when I
Yeah.
graduated vet school.
Yep. Yeah. Let's talk a little bit about COVID and pets that were acquired. So I saw a recent ASPCA survey that showed 23 million households acquired a pet during COVID, and that brings the US total up to 183 million dogs and cats.
Mhm.
And vet schools graduate about 3,000 people a year. So compared to 30,000 doctors for humans each year. So that math comes out to be somewhere around 1,300 animals per vet in the country. Where I'm sure you've felt that impact in New York City, I've gotten so many clients who acquired animals during COVID. I'm sure that has trickled down to your practice. Is that also part of the burden? Is that why you're looking for an associate veterinarian?
I mean, I've been looking for a while because I've had a very high clientele for a while, but during COVID, there was a lot of vet clinics that shut down, and I don't know if it was because of like the PPP loans and making sure that you didn't like spend a certain amount in order to get the loans. I'm not sure, but there were a lot of vet clinics that shut down. We stayed open the whole time. And yeah, I got a lot of new clients during that period. And now, my regular clients, they still kind of came through with COVID, but now everyone's following up because and so it's, increased case load, 3, 4, sometimes 5 weeks out with new and established clients. And now I've stopped seeing new clients for the most part for the last 3 months, and I'm still booking out like 3 weeks. And surgeries are almost 6 weeks. So it's a lot.
Wow.
It's a lot. And it's hard to say no to people. It's hard when, and there's so many vets that we're not taking on new clients. And so now we're kind of juggling with colleagues to be like, hey, are you seeing new clients? Are you seeing new clients? Who can I send these people to that are calling and put them in hands that I trust,
Yeah.
Crazy.
Yeah, it's tricky. So with that increase in pet ownership with COVID, I've certainly seen an increase in behavior issues, and we could talk all night about why I think that is the case. I think COVID, there was such a shortage of animals that a lot of bad breeders sort of filled those gaps, and people were getting animals from pretty unscrupulous places. And when you don't have good genetic stock, that can carry behavior issues and physical issues. Have you seen a spike in clients coming for behavioral issues, medication requests, things like that?
I mean, I would say one of the biggest things, which, when I was speaking with some behavioral specialists a year ago, almost a year and a half ago now, one of the biggest things we were concerned about is with COVID and everyone getting the fosters or getting rescue dogs or adopting, was separation anxiety being probably a spike in about a year. And now that's exactly what's happening is dogs that, even in my own clients that were fine for years and years and years, now are suffering pretty intense separation anxiety because the owners were there basically all the time, and now they're not. It's like cutting the cord, which is hard for them to adjust to.
Yeah.
So
Yep.
separation anxiety is the biggest thing they're going through.
Yeah, I've had an increase in that. And also or especially early on, I had a huge spike in resource guarding cases. And I think that was also attributed to people being home all the time and, being around the dog more and maybe trying to take stuff away from the dog that they weren't previously around to do that because they were leaving the house and going to work. And so I had a huge spike of resource guarding. And then, separation anxiety has been pretty consistent through that. You and I have lots of mutual clients. Training, many of my clients know training is unregulated. Unlike vets, trainers don't need to be licensed or educated to operate. How can qualified trainers like myself better partner with vets to help our behavior clients? What do you have suggestions on that? I know you've struggled a little bit trying to find competent trainers to refer out to.
Yeah, I mean, one of the first things I do with clients is I will kind of get an idea who they're looking at for trainers, and I have a rough idea of the trainers in the area and kind of how they practice. Obviously, if their entire page is full of prong collars, I'm going to steer them away from them. Or if they have balance training or do corrections, they're usually doing negative, basically punishment in some way, shape, or form. And a lot of the dogs I have, I mean, there's very few truly aggressive dogs out there, so few. It's a fear driven, almost all of the behaviors that we have. And those types of training just make it worse in the long term. Short term, they may adapt to get through it, but I've seen some trainers that unfortunately are unregulated, or they're from the fancy TV shows or the things that get hype, which
Yeah.
unfortunately are not supported by the Veterinary Behavioral Board of the Veterinary Behavioral Specialty College. I don't know what it's like AVB something. Um,
DACVB, yeah.
but they get hyped because good training won't sell TV.
Yeah.
Sitting there and doing treats routinely and doing slow like things over months. I mean, no one's going to watch that.
Right. Yeah.
So, and it's hard because I've seen some rescues really recommend certain trainers around here. And I've watched the videos and it's like, oh, look at the dog's doing okay. But they're practicing flooding techniques where they're just like standing in front of the dog who's terrified in the cage and is just like, how do I get through this without, having something bad happen to me? It's just, it's very sad to see. So for me, I mean, I research online first. When I look at a trainer, I try to see if they have credentials listed, which school they went to, what letters they have after their name. If they're open to discuss things with me. Like I've asked some trainers locally, like, hey, how do you practice? Oh, I'm a master dog trainer. Okay, what does that mean?
Yeah.
I'm a master dog trainer. What does that mean? What's your certification? And then I've gotten certification pictures and stuff, which is great, but what kind of what kind of training do you practice, basically? I've had some people reach out and they're saying, oh, I'm behavioralist, which is not really training. It's techniques. It's more, there's some psychology to it, but there's people who can go online. I can go online and I can be a dog trainer in 4 weeks with an online course.
You don't even need to take a course. You could call yourself a trainer and no one's going to stop you because there's nothing regulating that in the US. That's not the case in other countries, but the US is behind on lots of things. The comment that just came in from Emily, she's a vet that I worked with in New Jersey. And I've seen this also in, certainly in New Jersey and in New York, that veterinarians themselves, especially I find sort of the old school vets who've been in practice a really long time, who maybe haven't kept current on the current, recommendations from AVSAB and the behavioral specialist recommendations about not using punishment, that those vets are recommending leash pops and corrections and all of that stuff because they just don't know any better, because that's 40 years ago, 30 years ago, that was what a lot of people did, and they just haven't kept up to date with the science.
I mean, even me, well, God, I don't want to date myself now. 5 years ago in vet school, I knew nothing. Like my first year of vet school, I knew nothing about training. And even in vet school then, we didn't get any training. Everything I've learned is, in all honesty, the last 10 years. And even 20 years ago, I was trained to do the whole Caesar Milan mentality crap. That was put your dog, flip them over, do the alpha stuff, leash corrections, all that stuff. And in all honesty, my dog was incredible. She was an amazing dog, but regardless of what training she got, she was going to be an amazing dog. And then I got another dog, and he was terrified of a leaf blowing in the wind. And if I raised my voice to him, he would pee himself, and I was like, oh crap, this is not good. This can't work, doesn't work.
Right. Yeah. So, yeah. Do you have a sense of sort of what percentage of your clients are on medication, or you think should be on medication if you don't have client compliance? If there's resistance, sort of what's your biggest struggle that you find with the human counterparts if you think the dog should be on medication to help with anxiety or fear issues? What sort of resistance do you get from that?
I mean, I don't know if it's just how I communicate with people or because it's kind of known the kind of patients I work with, because I would say a huge percentage of my clientele are fearful and anxious and scared, terrified pets, dogs and cats alike. I would probably say 50%, if not more, because that's just what I've really focused on recently. So I get the terrified dogs where at another clinic, they're muzzled and held down by 3 people, or they've always had to be muzzled, and then with us, they don't have to be. And some owners are like, but my vet before they would just do this. And I'm like, well, that's not me. Like, this is how it's going to go.
Yeah.
And I want you to have a good experience. And so we're going to adjust the medications. It might just be situational. You're going to come in on drugs for your dog. And, and sometimes it takes a while. There are definitely people, a client in particular that you helped substantially with the first, like after 3 years of convincing him, he finally got training, and it took him having his dog hospitalized in the emergency room and probably not like having to be injectably sedated every single day because of his temperament to finally seek training with you. And now he's a dog that it's me and dad working together. I'm also very different. It's a huge liability. But I also am very different vet that I do let the owners hold, because in some cases, and in many cases, the vets are much better with the owners holding. This particular owner, he's now muzzle trained thanks to you. And we have a regimen of drugs he gets before he comes in. And I'm now, for the first time after I think I've been seeing him for 5-6 years, able to do a physical exam on him, draw blood on him. And he's scared, but he's not lunging and us playing like a dart game of me trying to give him injections. So
Yeah.
it's definitely needed. So, but sometimes it takes a while for them to adjust, because sometimes people think medication is a bad thing, which it's not. But there's also the flip side where people think, oh, just medicate and not train.
Yeah.
And that's the flip side, is you can't just medicate and not train.
Right. Yeah. And that's a conversation that I have with clients, that medication isn't just this magic pill that you're going to give them that's going to fix all the problems. It always has to be in conjunction with training. It's not effective otherwise, for long-term behavior modification. Yes, you could sedate a dog and they're not going to be reactive, but that's not going to give you long-term behavior change. And, I get similar resistance when I recommend that a client go talk to their vet for a meds consult. The number one concern is usually they're afraid that the meds are going to change their dog's behavior. And, I tell them if it does, then that's not the right medication. That's not the goal of medication. The dogs should still have their personality, but we're trying to bring that overall anxiety level down so that the dog is better positioned to be able to learn, to be able to make new associations and make training more effective and more efficient. I feel like, usually the first question is, well, what about CBD? And then we have a conversation about that, not being regulated and not being tested for behavior. There have been limited studies for arthritis and seizures in dogs, but nothing exclusively just behavior at this point. I wish they would, but they haven't gotten there yet.
But some potentially with certain CBDs that are currently undergoing studies for anxiety. I'm almost positive. I can triple check with the guy who actually published a book on CBD usage. He's a vet tech. He's fantastic. Sedell, I think is his last name. I'm not sure. But it's the only thing that's been studied has been for arthritis, and I believe there's still seizure studies out there with CBD. But there's only certain CBD companies that have actually, they do batch controls, and they actually have like you can see what's isolated, like CBD, etc., and they'll have it all outlined in each batch. So
yeah, and that's the important thing, because most CBD products aren't regulated, and so they're not batch testing. So you could buy 2 bags of the exact same product from the same company, and built into, if it says it contains 10%, there's a built-in under overage that is included. So 10% could mean anywhere between 5 and 15%. So you could have 2 identical bags that are from the same company and have completely different actual amounts of what's included, because they're not batch tested. Let's see. Emily's question. This is what I have a harder time with: convincing for the clients to put out the effort in desensitization, counter conditioning, and not just medicating, and that the meds help, but they don't fix everything. That's exactly it. That's what I was saying. The meds have to be in conjunction with training, that it's not a miracle cure. And so if clients, the human clients, aren't on board with investing in training, the meds are not going to give them the relief that they're looking for.
Yep.
And then Annette here, what is Annette saying? First local recommendation for an animal behaviorist was not effective. Example, separation anxiety. I was told to sneak out. Yes, that's a common one, which caused him to panic and was not helpful. Then I met Kate. Fortunately, our pet did not work out. He's on an 11th or 12th foster home. Yeah, so dogs that have separation anxiety often get bounced around because separation anxiety is such a difficult thing to modify. It's a true panic disorder, and very often requires medication. And sometimes it can be a little challenging to find the right medication to work for a particular dog. I have a couple of clients who are on their fifth or sixth medication trial at this point for separation anxiety, just trying to come up with the right cocktail that works. So those dogs tend to get bounced around a lot because one of the things you have to do in separation anxiety is suspend absences so the dog isn't left alone where they're allowed to continue to panic. If they're continued to panic when you leave, then that separation anxiety is going to get worse. That anxiety, gets heightened because they're being flooded with that absence and not getting any relief from that. But the idea of sneaking out, of course, the dog is going to know, and they're going to pick up on your pre-departure cues. They're going to figure out when you put your shoes on or pick up your keys. And some dogs backtrack it all the way to you're showering, and they figure out that showering leads to you leaving the house. So they start to panic the moment you step into the shower. So sneaking. Yeah. So sneaking out is not an advisable method for dealing with separation anxiety. Okay, let's talk briefly about, let's dive into your rescue. So you started that last year, right? It was
no, just like 5 months ago.
Oh, it's just, oh gosh, time has just time is all out of whack for me. So you started Small Bites Rescue. I love the name. You're focusing all on small dogs, like Chihuahuas are your thing. You love Chihuahuas, right?
Yeah. Some people, there's a couple of clients that are like, you need to put your voice that I make when I'm with them on some sort of audio thing to help Chihuahuas calm down. I don't get it, but mostly I'm a Chihuahua whisperer. I mean, they're just unique in their own way.
Yeah. So it's all small dogs. And do they all have severe medical needs, or that just happens to be recently?
Most of them, I mean, I have a bleeding heart and like $35,000 of my own money. It's easy to just do when you're not putting the cash out. It's like on your own equipment and your own supplies, and you don't really see the dollar coming out.
Yeah.
But no, there's like major ones like this trauma case. He has a shattered pelvis. Otis was a shattered pelvis. Sorry, the birds are being obnoxious. And a lot of them are older females that have memory tumors and need to be spayed. Almost every single old dog needs a horrible dental performed. The younger ones we get are more like fractures and broken bones. But even those are like very expensive, but fixable.
Yeah.
But the other ones are a lot of medical cases. Like Mabel, for example, right now she's got horrible pneumonia. She's got a memory tumor. She's hypothyroid, and obviously she still needs to be spayed and needs a dental. And she came in basically caked with her own yellow grossness. She's so cute, but she's, 2 baths and like scraping off her surface yellow crust with a flea comb. And then like Miracle, she's not necessarily, we call her our big bite. She was completely mutilated by her siblings, and she has 4 different resistant forms of bacteria in her leg. And 3 vets told me, vet surgeon specialist told me to amputate her leg. And the owners had been previously told to euthanize, and I was like, no. So it took 2 months for her leg to fully close, and we're still working on the underlying tissue infection, but she's an amazing dog. She's fantastic. So yeah, they're all medical. So I have a soft spot for the old decrepit ones.
Yeah.
I just wish they could get adopted.
Yeah. So you have a small foster network. Is that how you're supporting this?
It's very small. I wish I had more fosters. And Emily, I like that you like little chi-chis too. Let's see. Yeah, I have a small handful of an amazing fosters, but it's hard because one time I had, I think, 6 dogs here at the clinic, and I don't want them to stay in a cage the whole time, but it's hard to find
Right.
fosters, especially for ones that are like have medical needs, you know. And a lot of
Mhm.
them that I do have, they have separation anxiety. I mean, I have almost every one of them on medication, um, except Miracle. She just chills in a cage. She's hanging out in
Mhm.
the hospital right now. But yeah, it's hard. I definitely need more fosters, like consistent fosters, that basically are like the ones today. We had Harper get adopted tonight, and the owners were like, "He's getting adopted. Who do you have for that you need foster?" So they basically came in, dropped Harper off, and went off with another dog. So
Oh, wow.
I've got a couple amazing guys. So, but I need more.
Do you have, is there a foster application on the new website for people if they're interested in
Um,
fostering?
I don't know if there's a foster application. We're still updating that, but what they can do is, because a lot of the questions that we have for our adoptees, we would want the foster with the same mentality. So they can always just apply online and just say they want to foster instead of adopt. Um,
Okay.
so yeah, that'd be
Yeah, we'll put up
amazing.
that link. We'll put up that link at the end.
Perfect.
And then I do you have and I know I support you through the Amazon Smile charity program, so percentage of all of my Amazon purchases go to you. But other than that, do you have like a specific Amazon wish list, or how can people support the rescue?
I think there's an Amazon wish list. There is also a Chewy wish list, and in all honesty, there's a pay. Is it called Patreon? I,
I saw
Patreon.
that there was a Venmo that people could donate to.
Yeah, Venmo is where it's at now for donations. And um, I'm working on PayPal because one of my clients 2 years ago decided to put in the notes for PayPal sucralfate. And so PayPal flagged anything associated with my name
Oh
because it was
no.
medication. So I've been working on that for 2 years to get it removed.
Oh,
They basically needed like my veterinary certificate. They finally responded. So after 2 years, I might get it removed and then I can receive PayPal payments.
oh
Um,
my goodness.
for right now, it's just Venmo or checks if people want to send checks. But
Okay.
then the PayPal account, which is like $5 a month, $10 a month, or $15 a month, and I try to put something on there if I can, like a couple times a month.
For
Um,
Patreon.
yeah, yep.
Okay.
But that's basically it.
Okay. So that 35,000 that you mentioned is that essentially the running tally of your expenses as a veterinarian providing care for these animals?
Yeah, that's what I personally put into it when I tally everything up. Um,
Wow.
I mean, Otis's pelvic surgery alone was 6.5, 7 grand.
Mm.
The surgery, just the surgeon's fee on with because they gave us a little bit of a rescue discount. Just the surgeon's fee for Chase is 4,750. So that, but that doesn't include the fact that he had a urinary catheter and was on IV multiple modal pain meds for days, and he's been here for over a
Mhm.
week. So none of that's included in that price. That's all
Yeah.
me. So that's just that's why I say like it's hard because it's not like I'm going and being like fentanyl costs this much, this fluid bag costs this much. I'm
Yeah.
just doing it because it's the hospital.
Right. Yeah.
But yeah, there's been a lot, and like all I know other rescues go and they'll remove a mammary tumor, but they don't send it out. I send everything out. I do
Yeah.
chest X-rays in every geriatric. I do full
Mhm.
blood work on everybody, and like for these guys, we diagnosed 3 hypothyroid dogs, which is fun. But I mean, it's a treatable disease.
Yeah.
But you know, and Miracle's had probably $600 in cultures alone. Miracle's
Yeah.
probably easily been. I sedated her every single day for 6 weeks straight
Yeah.
to do bandage changes. So, and the bandage, the honey, and all that stuff alone was 1,500. So it just all adds up very
It all
quickly.
adds up. Yeah, I
Yeah.
remember when you first started the rescue, I remember seeing some pretty not nice comments about people just kind of assuming that you should donate those services because you're a vet and you started this rescue. And
Yeah.
obviously you're doing it at a lower cost. It's cheaper for you to do that yourself than send it out to, AMC or Verg or whoever else. But it still costs money for those fluid bags and all the medications and all of that stuff. So you, has that been a contributing factor to some of the stress and anxiety that you've been feeling, like sort of people making those assumptions and being pretty vocal about it?
I mean, I put up a highlight. I've removed it since, and it was basically like, if you want to put up hate stuff, I'm not going to tolerate it because it's kind of stupid. And
that's
it's
great.
weird because the rescue, I mean, in the vet clinic destroys me multiple times, dealing with people, in all honesty. Whereas a rescue, it's really hard work because I thought I would just save, a couple dogs a month. And I think we've saved almost 50.
Wow.
So, and they're all big medical cases. It's not like we have small guys.
Right.
So, it's been so rewarding to be like, you know what, I want to do this. So I'm going to do it for the pet. They've been like abandoned by their owner that didn't want to do things for them and couldn't afford it. They became homeless, whatever. So now the pet needs everything that they need. And I'm going to do that. Now, I joke and say, oh, I'm single and I have nothing better to do. Like, it's just date money, but, being single for 10 years, that's a lot of dates that can just go towards the animals money wise. But it's been really rewarding to be like, this pet has like an incredible life now. And so what if it cost me a couple grand? Like, that dog's super happy.
Great. That's amazing.
So
I'm glad that you're finding that like joy and fulfillment in the rescue side, because I think all of us need something, especially when you're in a high stress job that is a lot of pressure and it's emotional and can be really taxing on people, mentally, that we need those places to be able to, do something that's fulfilling and sort of refills our cup, so to speak, to give us the energy to keep plugging on and dealing with the more difficult cases that we have. All right. Well, that's the end of our questions. I see that Ruth left us a lovely comment in the chat box. Thank you, Ruth. You're a big fan and I appreciate you. Thank you to both of you for all the work you do and the immense help you have given so many. Thank you for listening and watching. I do want to put up your Venmo in case anyone feels moved to make a donation after this conversation. And I really want to thank you for coming, and I really want people to sort of have this takeaway to, the stuff that we talked about tonight. Some of it is tough stuff to listen to, but to encourage people to really be kind to their vets and their vet techs. And none of us like waiting in the parking lot and having phone calls about animals. Like, we just, had this whole thing with Barbo, and we were sitting outside the emergency room, and talking to them on the phone. We're not in there with him. It is by no means the ideal situation for the dog or the people. But we're in the middle of a pandemic. We're trying to keep everyone safe. So as frustrating as it is from a client and dog owner perspective to have, these long waits for appointments or to be turned away, for certain things, it's not out of malice. You're not doing these things on purpose. It's just the fact of everything that we're going through in this current pandemic. And I think people, especially at emergency clinics, are emotional. They don't know what's going on with their animal. They're worried. And those emotions are running high, and it's easy for people to kind of fly off the handle in those situations. But I really hope that people have learned a little bit of insight here tonight from everything you've shared, and that gives them the ability to be a little more understanding with their own vets and, situations that they may be dealing with.
Yeah, I mean, the emergency hospitals right now, there are some that are shutting down on the weekends because they don't have enough staff, which just is a huge burden to the other emergency hospitals. And it's hard to say no. I mean, wait times before, maybe they were a couple hours. Now, some, I know in Pittsburgh, one of the places I used to work, their wait time is 6 to 8 hours, and if you're one of those people that's sitting for 8 hours, I mean, usually that your pet is healthier or at least more stable than the other ones that are there.
Yep, the
it's
very
hard, you
first
know.
time. Yep, when we first brought
No,
Bargo in, that was the first question. They were like, "Is he stable?" I was like, "Yeah, he's stable. We just, something's going on, but he's stable. He's not actively convulsing. He's not vomiting blood or anything like that." So yeah, I know that at one point recently, Oradell over in New Jersey, their wait time was 7 to 8 hours for emergency. So yeah, it's a challenge, across the board for the clinics and obviously the owners and the dogs. And we just all need to kind of be kind to each other and do whatever we can do to get through this. I know you mentioned earlier that you're looking for an associate. You're also, I saw on Instagram, looking for office help and tech help. Is that true?
Yeah, so even if it's just me, I am thinking of trying to consider expanding, not so much because of the rescue, but just for caseload, and kind of also the whole mentality potentially of if you build it, they will come. I mean, I have a small office, but I utilize the space pretty well. But I have the option to potentially expand in the same location that I'm at.
Oh, that's great.
But it would be great to be able to see more cases, have 3 exam rooms and I can just run between them, even if it's just me, and to have more tech appointments. And if we had tech appointments more consistently, then I could have basically hire another assistant on. And then reception wise, unfortunately, we are losing one of our sweetest and kindest reception staff because they have to go back to a previous job that they had that was trying to balance their lives out. They have just unfortunately now take over 2 businesses themselves. So they had to withdraw, which is very sad for me because they were incredible. They are incredible.
So what is the best way for people to contact you if they're interested in any of these positions?
Dr. Luce. So I'll just put it in here, you guys. Dr. Luce at the neighborhood vet, but it's just DR. Dr. Luce at the neighborhoodvet.org. Or they could DM on Instagram and I can send the link with the email, but basically resume and then a couple references.
Great. Perfect. Well, thank you again for your time. I know you are a busy, busy person, but I appreciate you taking time out tonight to enlighten us and have this important conversation with everybody.
Thank you. Thanks for everybody who is plugged in.
All right. Have a good night, everyone. Thank you. Bye.